Actually, funnily enough, my wife came here first, so she's a rural GP as well, working in the same practice, and she came here as part of her registrar training and really loved the practice and the community and the region. And I was working in the city at the time and saw how great her job was here, and how the sort of work-life balance and community feel worked really well. So I decided to come up and join, and I've loved it here ever since. So couldn't really ask for a better location for a practice. So we sort of have a great mix of all the different domains of rural general practice, with anaesthesia and obstetrics and surgery, as well as providing smaller outreach clinics to Borough and Snowtown, where we get the feel of a one-person sort of GP clinic as well, which is really nice. We're only an hour to the beach, only an hour to the river, and only an hour to Adelaide, so it's sort of really it ticks a lot of boxes for us. I think we very much feel like we're a fixture in the practice and the community here as well. So I think that's certainly a strong factor. It's a really good collegiate feel in Clare. So there's quite a few doctors here, but we're still quite busy between all the different sites and all the different jobs. And but there's a strong social community amongst the doctors and other health professionals. But then also I'm sort of go out to parkrun every week, and my wife has her book club, and my daughter goes to all the different events for kids here as well. So we just we've taken a little bit of time, but sort of I think enjoyed becoming part of the community, I think. And aside from the work stuff, I think that's probably the strongest factor keeping us here. I think as with a lot of country placements, I think the opportunity to have just unique exposure at an intern level is great here. So not having to fight to get your opportunity to put in a gelco or a cannula, but having a huge range of opportunities available to you for training and teaching and experiences, and being able to start off in a rural generalist training role from day one of your internship is pretty unique to this area, I think. So yeah, it's the best of both worlds, really. The ability to be in what people traditionally think of as a rural general practice role, working between the clinic and the nursing home and the hospital with a mixture of acute and chronic medicine, but at the same time not being in the middle of nowhere. We're an hour from Adelaide and an hour from the beach, an hour from the river. The Flinders Ranges isn't too far away. We certainly don't have to compromise on facilities and cafes and restaurants and things like that. So it certainly doesn't feel, it feels like it's the best of both worlds, really. So yeah.